Hi, so here are my muscles and muscle movements. Um, Here's the frontalis muscle that raises your eyebrows and it compresses or wrinkles your forehead. Um, that is like this, I guess. My eyebrows are raised and forehead's wrinkly. The masseter muscle that elevates the mandible. You use it in chewing. It closes the mouth when you're chewing. So that would be kind of using the mandible or using the masseter like that. Um, the orbicularis oculi muscle that closes your eyes and blinks, or it you use it to blink. So that would be like that would be using the orbicularis oculi muscle. The orbicularis oris is that compresses and pushes your lips outward, kind of like in a kiss or a whistle. So that would be like that, I guess. I think. Okay. Um, Latissimus muscle that you use that when you're making an expression of like surprise or shock. It tenses the skin of the neck. Um, some of these are tricky, but that is kind of like I don't really like that. Maybe like that. My neck is kind of tense. Um, the temporalis muscle that closes the jaw and pulls the mandible backward. Um, Unilateral action of one temporalis muscle guides the mandible to the side of contraction. Um, so they're kind of like that. That's unilateral contraction of one temporalis muscle, kind of. But and you can use it in like the to chew. Um, there's like the rotary chew where you make like three different kinds of chewing movements, and I think that's the temporalis muscle too. And then the zygomaticus muscle that draws the corners of your mouth backward and upward, so that's like a smile, and that's like that. Um, the sternocleidomastoid muscle, you use that to flex the neck. So flexion, that's with the neck, that's going to be it's going downward toward your chest. So like that's flexing my sternocleidomastoid muscle. Um, the external oblique. Um, it compresses the abdominal cavity, and unilateral contraction of one external oblique will rotate the abdomen to the opposite side. So if I like do this, um, my my internal oblique on this side is contracting as I turn this way. Um, the rectus abdominis muscle that flexes your abdomen, that's like your six pack muscles. So when you're like flexing, you can see the muscles there. I don't have a six pack, so I probably, but I mean, if I do like that, then I'm flexing the abdomen using those rectus abdominis muscles. Um, the transverse abdominis is another one that when you contract it, you compress your abdomen. So just more of like that. And the transverse abdominis, it runs, I think, more an angle. I kind of forget exactly on the transverse abdominis, but I know it plays a role in contracting your abdomen. Um, the pectoralis major, um, you use it to horizontally adduct the arms, so of the shoulders and arms. So you're bringing them in toward the trunk. So if I do like this, I'm contracting my pectoralis major muscles, or like this too, coming in inside toward like the trunk and midline. The pectoralis minor muscle pushes the shoulders out and protracts the scapula. Um, so if I do like this, and I'm like pushing my shoulder blades back, I'm contracting the pectoralis minor muscle. The serratus anterior, it has like 3 different classes of movements, but the middle fibers play a role in contracting the scapula too. Um, the lower fibers rotate the scapula upward, so it's kind of like backwards, and the upper fibers will rotate it downward. I guess the easiest one for me to think of to demonstrate would just be to protract the scapula, and that's using the middle fibers of the serratus anterior muscles. Um, the external intercostals, um, when they contract, you inspire, you take air in, you breathe in. So if I mean, I just did it, but I can do it again. Like that, like breathing in. When you breathe in, those external intercostals are contracting. And they're all like in your rib cage. They're external. There's internal intercostals too, but the externals are like outside or in between your ribs. Um, external though to the internal intercostals. Um, the erector spinae muscle, bilateral action stabilizes the trunk or holds you upright. So if you're just standing straight, those the erector spinae muscles are contracting to keep you upright. Um, and unilateral action um, of one, like on one side of the erector spinae muscles, will bend the person forward. Um, so like that. And I imagine different sides probably change which way you're pointing when you're bending too. But I think that's all the muscles um, in our tables. I'm just trying to see if there's anything else that. Um, okay, I think that's everything. I kind of forgot some stuff, I think, but yep. Okay.